This week on the Evolve to Perform podcast, we were honored to have Dr. Amy West join us in studio. Not only is Dr. West a physiatrist, but she's also an author, a CrossFit athlete, and a Jason Mraz Superfan. In this episode, we discussed how Dr. West's first career actually wasn't in medicine and what ultimately led her to becoming the CrossFit Doctor, why she chose physiatry and what it is, things we can do better in the world of rehab medicine, why it's important to keep moving even while you're healing from an injury, and the different work that Dr. West is currently doing to impact the rehab, recovery, and longevity space. And hint, it's not surgery. So add Plain Jane by Jason Mraz to your queue and let's get into it.
Hey, welcome back to the Evolve to Perform podcast. I'm Kingsley.
I'm Jordan.
And today we are so lucky to have Dr. Amy West as our guest here in studio, I guess we want to call it.
Sure, yeah. I'll call it that. Yeah.
So, Dr. West, what's up?
Oh, same old same. Treating patients, doing my thing. That same as usual, but
Just grinding.
trying to, yeah, for sure. Yeah.
Here, this is what we want to do here is we want to give our guests like the platform to like share your origin story.
My origin story.
Yeah, we
Okay.
want to take it back a little bit to not how you became the CrossFit Doctor.
Well, it's definitely not a straightforward story. I've always been involved in sports my whole life. I played lots of things growing up. We'll say it's sort of a product of being a younger sibling. My brother used me as a target for many things, which was like the best kind of training you can get.
Yeah.
Playing against someone who's 5 years older. So I've always been into sports, always played lots of sports, and never really knew where that was going to go. I played softball in college. I played abroad, actually. I played in Holland for a little bit, sort of semi-professionally there for a little bit. And at the time, I was going to school for film and television production, so I worked in television, both in New York City and in London. I was doing editing, sound engineering, production stuff, working a lot of music television, actually.
Yeah.
So I did that for a long time. Not a long time, but a period of time. And then I sort of made a switch for multiple reasons, but one of the reasons being like I just felt like, okay, I've always liked school. I've always kind of been into like studying and stuff like that. I feel like if you have that ability, you have that kind of desire to do that, maybe you should kind of use that to like help people or do something good in the world, So I went back to school and I had to do a bunch of science classes and things like that. And then found myself in med school. So I was at Harvard Med for 4 years, did an education degree. I was there also. And then in my when I was doing my education degree, had like more time on my hands than I normally would during med school. And as a result of that, I'd pass a CrossFit gym that was near where the med school was. And I would like look to see what they were doing, and I'd be like, oh, that looks cool. Like, I don't know. This was like 2012 maybe. And I always like would see them doing stuff and wanted to do it. And then because I had extra time on my hands, I said, I'm going to just do it. And I like instantly just fell in love with it. Partially because it was like a chance to kind of be part of a team again and like be like, you have people cheering for you and like a group of people all doing the same thing, which I love team sports growing up. And then you get to a certain age and then you just don't do that anymore. You're just like, oh, go get on a treadmill. And I hated that. I hated like traditional gym stuff. I like being active. I just didn't like going to a regular gym.
Yeah.
So, I started getting involved with that. Plus I was like learning how to do all these new things with my body that I hadn't like ever done before, like pull-ups and stuff like that. And as an adult, we don't really acquire new skills very much. After a certain point, so when you're doing all these things, it's very exciting. I think anyone who's like starts CrossFit you like rapidly gain all these skills that are very exciting to you,
sure.
Or to most people anyway. So I started doing that, and then a lot of CrossFit's sort of based in this idea of functional movement, which you know a little about.
Just
a little bit. Yeah. And the same time I was doing that, I was spending a lot of time at Spaulding Rehabilitation Center, which is the big kind of rehab hospital associated with Harvard. And I found the field of physiatry, which is what I do. It is kind of at the time, especially a very like well-kept secret. Not many people knew what that was,
Right.
but it's a lot about, we're doctors of function, you know, so teaching people how to move well, how to assess that, how to get people back to being functional in their everyday lives. Like that's the focus of what we do. And I sort of discovered that at the same time I discovered the sport of function. And it was like this very like beautiful, like cohesive thing. But at the same time, neither one knew about the other. So I have been on a journey for the past 12, 13 years of, you know, teaching CrossFitters about physiatry and teaching physiatrists about CrossFitting, and how the two kind of are very much alike, very much aligned. So, and through that, in that journey, in that space, I've met a lot of really cool people, you know, and you know, you being one of them as way of, you know, through Kelly or whatever,
Sure.
you know, but a lot of sort of healthcare providers or healthcare adjacent people who have kind of been in and out of the CrossFit space or know people in the CrossFit space. And we all kind of think alike and sing the same song a bit. So as a result of that, you know, that's just kind of how I ended up kind of doing what I do now. Because we're all kind of talking about the same thing. So that's how I got kind of so involved in the CrossFit space. And then, you know, now I do sports medicine specifically, which sort of a subset of physiatry, and I treat a lot of CrossFitters. I treat a lot of people who are in the gym world. So the two have they just kind of mix together. So
yeah,
here we are.
And here we are,
Yeah.
and here we are.
Yeah.
But I'm sure too, like, you know, it probably wasn't. Do you find like it was easy early on to kind of get both sides to, you know, to make sense of this thing that's just obviously in front of their face?
No, it's still not. So
What do you mean?
No, there is so especially back then, CrossFit was definitely a dirty word in the academic space for many reasons. Some of them more political than anything, and you know, we were really kind of, as CrossFitters, considered kind of really crazy and out there, wild people. And you know, traditional medicine doesn't really follow that. And even as a physiatrist in medicine, other doctors don't know that we exist.
Right.
So it's like this, I'm always explaining what I do to people, whether they're outside of the gym or in it, or in the office or whatever.
Yeah.
So I'm constantly explaining myself to people and kind of seeing like how, and in both cases, a lot of times, I feel like what both things offer is exactly what the person needs. And like getting people to see that is not always easy. So
Right.
yeah.
Right.
Yeah.
No, I can totally like empathize with your feeling of trying to describe, you know, to people what it is that you do.
Yeah.
So I'm going to put you on a spot a little bit if I can, right? Is in the fewest amount of words possible, can you describe what you do?
Yeah. So we focus on physical manifestations of disease processes on the body.
Okay.
So what that means?
Yes.
We treat how disease or injury, whether that's permanent, like a spinal cord injury, a traumatic brain injury, or a temporary, like a sports injury, how those things affect you physically. So, you know, and I use this example a lot, like, for example, like if you have a spinal cord injury, right? We're not treating the spinal cord injury, right? That's the surgeon. They are the ones who are going to put your spine back together.
Yep.
But then how that spinal cord affects you physically, meaning, you know, dealing with tone and pain and going to the bathroom and all that stuff,
Yep.
that's what we deal with. Similarly, there's like cancer physiatry. Like we're not giving the chemo, we're not doing any of that, but how that chemo affects your body, how the treatments affect, how the tumor resections affect how you move and feel. Those are the things we focus on. So.
Yeah. So in effect too, it's like, you know, you're the ones that actually spend more of that time with your patients.
Oh, totally.
You get to, you get to know them much more. You get to develop a relationship with them more so.
Yeah, definitely. I mean, because we have to, like, our job is sort of looking at like how this affects your life. So you have to understand someone's life to do that. You know, like, and specifically what I do, I'm more in the, I'm more in the sports medicine side of things, so I treat lots of injuries and pain. But the way, you know, and I say this, and I say this with a lot of respect. So I don't want to say this, it seems like it's coming across and not that way. But
Yeah.
so, and I see this just as a result of the people I work with, because I work within an orthopedic surgery department. That's where I'm housed. And I work with I see a lot of residents, orthopedic residents, et cetera. And what orthopedic surgeons really love doing is operating.
Yes.
Right? And a lot of their training is focusing on how to do that well, as it should be.
Yes.
Right? Like,
sure.
You want the guy who's like taking a chainsaw to your hip to like really know how to use it,
Yeah.
right?
Yeah.
But that same person is probably less excited about thinking about your butt strength, right?
Right.
And he's also probably not really interested in assessing that. And not because he's a bad doctor, not because he's an idiot, not because he, you know, doesn't care. It's because his training is to make sure that, you know, he knows the right sutures, the right tools, the right angles, the right techniques, to make sure that like everything that he's doing in the operating room works as best as possible.
Yeah.
So that being said, you know, a lot of you know, what's considered orthopedic issues, they aren't operative.
Right.
So then I think that sometimes, you know, and I'll use spine for an example. If you have back pain, you know, the guy who's really good at drilling holes in your spine and protecting your nerves when he does that, so he doesn't paralyze you, is probably less enthused about talking about how your hips are, how your glutes are causing your hips to be uneven. You know, it's like, and it's not, again, it's no fault of theirs, or, you know, lack of
well, there's only
desire, right? There's only so much they can do, right?
Sure, and
you know,
there's only a limited amount of resources and bandwidth that one person
exactly.
could
You know, and they probably have 50 people on their schedule who they just operated on. So
exactly.
like, so then the, you know, the thing where I think maybe people don't really necessarily realize is that, like, if you have a back issue or spine issue, seeing a spine surgeon sometimes is not like the best thing to do, because they're looking at, you know, is this something that's going to kill you, paralyze you, cause you any severe deficits?
Right.
If the answer to those things is no, then it's like, you know, often then the attention goes elsewhere, because that's what they're trained to do, right?
Yes.
So.
Yeah. Yeah. So that's a really good, I think to me that's a really good, you know, description, and paints a really good picture.
Mm-hmm.
You know, so like, do you feel then too that, I mean, look, with patients, you know, they'll do the Google thing,
Yep.
right? The Chat GPT thing, and be like, what do
Oh,
I
boy.
do? It's like, oh, you know, I tweak this and I need surgery already. So like, do you think that you should be more of the middleman before the patient sees the surgeon?
Sometimes, yeah. I mean, or I'll say, like, it depends, but I think my utility is in maybe if someone's looking to avoid surgery, or looking at sort of like the whole kind of picture, the underlying cause of like how things are moving and how strong they are and things like that. I tend to kind of look at things in that way. And listen, if you need surgery, I'm happy to send you to someone. Like, I'm not trying to, I think a lot of surgeries are needed. I'm certainly not someone who's against that. And if you need it, I'll be honest with you and say, like, I can't do anything for you, or like,
Right.
I've done what I can and now it's time to move on, you know?
Yeah.
So I'm not sure if that goes both ways though.
Yeah.
So, and sometimes people don't know what they don't know, right? So.
Right.
What are some of the most common things that you treat?
Common things, so the quote-unquote hip pain, where most people don't know where their hip is. So they say hip pain, they don't really mean their hip joint,
Right.
which is the groin, right? It's butt, back, side of the hip pain. So I treat a lot of that. I treat a lot of like knee pain, like patellofemoral pain, things like that. And a lot of times with those diagnoses, if they have seen someone before for it and have been given the correct diagnosis, which not always the case, have been given the correct diagnosis, often it's just the fact that like they haven't really understood then what the cause of it is.
Yeah.
Like, you know, it's like you have knee pain. Yeah, it's patellofemoral pain. non-operative, go do some PT, have a nice life, which is not wrong. It's accurate.
Yeah.
But, you know, sometimes it helps to say, okay, here's what your x-ray and you see the patella's a little laterally tilted. Can you stand on one leg? You see how when you do that, your knee caves in, you need to fix that. Like just sort of pointing out, you know, so sometimes I find my role is just more of like explaining. So that's I see a lot of that. And I see a lot of shoulders. I see a lot of arthritis. I do tons of injections, so I'm certainly not anti-intervention by any means. I do lots of that. And then, you know, the carpal tunnel, trigger fingers, all these kind of things. So, yeah.
Can you speak to a little bit more about the type of injections that you are doing?
So yeah, I do your run-of-the-mill kind of cortisone injections and things that need that, or people who want that. I do hyaluronic acid injections for you know, people who need that, which, you know, basically is like cushioning in joints. That's how I describe it. And then I do PRP injections as well. You know, PRP injections have some utility in certain cases. I do think you can find people who will put PRP anywhere and charge you a lot of money for it. It works well in specific cases and specific people. In other places, it's a little more experimental, and in other places, it's just kind of a scam. So so when people say like talk about PRP, that it's a very big topic, and it's also very it varies a lot from place to place as to who's doing what and how much and where, and you know, so I do PRP, but it's not, you know, in very specific places.
Can you speak to a little bit more about like just what the mechanism of PRP is? Like,
so I mean, kind of like the general idea is that we take your blood, we spin it down, we get like the platelet-rich layer, which kind of has like the healing factors, if you will, and then we inject that back into the place of pathology. So, and then over time, the idea is that it causes an inflammatory response, which in and of itself is healing. Although I wouldn't say it like necessarily heals tissue that's torn. It can make it less painful, and maybe some small amount of healing, if you will, but it's not like a miracle thing you inject and things are, it's not like a Wolverine kind of situation. So I think there's a lot of false kind of promises with it. And if you use it in, you know, certain cases, like very severe arthritis, it's a drop in the bucket. Full, you know, complete rotator cuff tears is not going to do anything. And I think there are places and clinics that will charge people a lot of money to put it all over the place, and it's like it's just a waste of money. So so the thing is, it's an out-of-pocket cost regardless, so insurance doesn't cover it. So so I'm very kind of blunt about it with people. I go, this might help you, it might not, so if you want to put the money out for it, you're welcome to, but I can't promise anything, you know. So,
okay. Thanks for that.
And how would you say that people typically find you? Like, do other doctors refer to you?
How do people find me? Well, kind of the most common thing is like I work for Northwell, which is a big health system, and there's like this number, it's called an ortho fast track. So people just call up and say this thing hurts. And then there's a call center, and they kind of just put it on people's schedules. So sometimes they're right, and sometimes they're wrong as to who ends up with me versus, you know, and it happens a lot where it's like, well, that person should have seen me and this person should have seen that, you know, but it happens. But so that's like the main thing. But then other than that, then it's through, you know, things like this. So like people that I know in the CrossFit. So like I know a lot of CrossFitters, I know a lot of CrossFit gym owners, I know a lot of physical therapists who are kind of associated with the space. So I do see a lot of patients through those kind of mechanisms. Every so often I'll see somebody who's like, oh, I saw you on that podcast and blah, blah, blah. You know, so that happens. Other physicians, both in and out of the health system, you know, this kind of depends. I've been doing some stuff with some research with some female athletes. So that's kind of, I've also been seeing like a fair amount of people looking for specific things pertaining to that. So.
Yeah, she's all over the place. So if you search up hashtag CrossFit, you'll find Dr. West. Probably hashtag sneakerhead. You probably find that too. That is true. Yeah, right? That's true.
But
she's just like, you know, ingrained in the community. So especially the active community. So she's easy to find.
Well, hopefully that's the goal. Yeah.
So even like you know, I guess even speaking of other things too, like you mentioned a couple projects. Like, so what are some projects that you're currently involved with?
All right, so I'll talk about, I guess, 3 different ones.
Yeah.
So one is that, so we're just wrapping up now, but over the past year, myself, and we've partnered with Pace University, the female athletes at Pace University, and Whoop.
Yeah.
To basically, we've been tracking the female athletes there for the year, and we're collecting all kinds of data on them, and correlating it with the injury type and rates that we're seeing. So we're looking at all this physiological data that the band already like collects.
Yeah.
Things like menstrual cycle, sleep patterns, travel schedule, training schedule, things like that.
Yeah.
All of this data with the injuries that we're recording. We also did a bunch of focus groups there to ask them about different other things. We also have a lot of mental health data from surveys they filled out over the year. So we have a huge data set that's like just wrapping collection now. So I actually have to check in with the people who are doing that to see like where we're at with everything. But I predict that we'll have some pretty interesting data as far as like the female athlete specific data, which as far as I know, the biggest data set of its kind. Like there's nothing else like it that I know of that's this big.
Yeah.
And that has this much data and this much stuff to sort through. The problem is because it's so big, then we got to do all this kind of sorting, which is not my specialty.
Yeah.
I have other people handling that part of it. But hopefully by like, a year from now, we have a lot of really cool things that we can say, or at least directions we can go in, because potentially this is something that the NCAA can look at and say, okay, like maybe we shouldn't have back-to-back games on, or whatever it is. And also there's a lot of like hype about like menstrual cycle data and like what's important and not important. I think there's a lot of people like fighting over like it matters, it doesn't matter, but whatever. So I think we'll just add some data to that, whatever side it lands on, and then also looking at things like OCP use. So almost everybody's on some kind of OCP. So looking at like, does that help? Does that hurt? Does it not do anything? So that's another kind of thing. So that's kind of in the background. That's been going on for a year. Just recently, so literally like this week, just had a textbook published that I've been working on for almost a couple of years at this point, about high intensity functional training and its clinical uses, applications in sport, rehab, training, and the HIFT, as it's called, is basically CrossFit. It's basically the way that academics talk about CrossFit. I mean, obviously there's takes on that. So we say HIFT using CrossFit as an example, because CrossFit's a brand that's not necessarily a thing we could talk about academically. Yeah. And it's also not a word that was publishable like 10 years ago, like I was saying. Now it's a little bit different, but so over the past couple of years, so like I was saying, over the past 12 years, I've met all these people in the healthcare space who were doing all these really cool things. And also I would see what the kind of things that they were doing and saying this works. And, and of course the academics' response is, well, where's the proof? Where's the evidence of it? So for years I've been saying, there's gotta be, people are collecting, people are doing it. So, and I actually wrote a paper about it 10 years ago that I couldn't get published. So I've been sitting on this, me and two people from Harvard that I've been working with. So I've had this since I was in residency, and I've been sitting on it. And I said, well, if they're not going to give me a platform to do it, then I'll make my own. So I had done some other textbook work, and I just said, well, how about doing a textbook about this? And they said, okay, well, So and then I started contacting all these people, like cardiologists and therapists, and like people working with the elderly community, people with pregnant ladies, people working with cancer patients, spine surgeons, nutrition experts, so there's got probably a list of, there's 11 authors in the book. There were actually way more, and people kind of dropped out over time, unfortunately, but and all kind of talking like evidence-based uses of what they do using HIFT. And how I see it is it's a resource for anyone who's using that type of training, especially like affiliate owners, or if someone comes in and says like, oh, I have a heart condition, I don't think I can do this. Well, here's something you can read that maybe can help steer a conversation, not necessarily diagnose anyone or anything, but like say, okay, well, here's the evidence behind this kind of thing, maybe you should talk to your doctor about that, or how to train someone who's 80 years old. Well, Dustin Jones is his name. He lays out very kind of thing, or whatever the condition is or the situation is. Now here's a resource people can point to. And like I was saying with, I told you before this, like academic publishing, there's like no money in that. Like I don't make any money from this. I'm not like selling it to sell for my own benefit.
Yeah.
At this point, it's literally just something I wanted to get out in the world to help other people with. And it's now available. So that's exciting because it's been taking a very long time to get it done.
Yeah.
So.
And what's the title of the book again?
It's called, High Intensity Functional Training, clinical applications in, I think it's like rehab training in sport, rehabilitation training in sport, something like that. So I edited it. It's through the textbook publisher, Elsevier, I can't mispronounce it. Yeah. Right. But so that like just came out. So that's exciting because I a lot of people put a lot of work into it, and happy to get it out into the universe.
Yeah.
Also in it, I had so when you edit the book, then you control what goes in it. So I was able to write an introduction, which basically calls out some falsified data that was presented.
There you go.
So I just sort of stated that, and saying this is what happened. And then I quite ironically, potentially this textbook may be sold at the very conferences of the people who had tried to defame the sport 12 years ago. So it's all kind of come full circle for me, and I just kind of sit back and laugh at it a little bit.
For sure. But you know what? That's amazing. And it's just like, it just shows that, it shows that we're learning, we're making some progress here.
Yeah, and it's like, it's kind of one of those things too where the whole time, starting 12 years ago or whatever it was, 13 years ago, saying like, I know this works.
Yeah.
I know this is not what they're saying it is, or I know this is the way to do stuff. And it took this long for everyone to kind of come around to that. It's funny, if you look on, also if you see other fitness models, how they've all kind of morphed into CrossFit-esque things.
Yes.
So like Peloton is now doing strength training, functional Peloton. Orange Theory has like an Orange Theory fit functional thing. The best one is if you look on Gold's Gym, they have something called Gold's Fit. And they have this, I'm surprised they weren't sued because it's like CrossFit. They have now CrossFit boxes in Gold's Gyms, which is hilarious.
Yeah.
But they also then talk about like, you watch a little promo video for it, it's like, welcome to Gold's Fit. It's like very functional movement with the community. And it's like, it's this.
Yep.
And you go, 10 years ago, these people were calling us crazy. For a long time, my whole thing was like, I would talk about CrossFit to academic, groups, but like not call it that. And sort of again, like, so you agree like functional movements are good. Oh yeah. So high intensity was, again, that was even villainized, but then that all came, HIT training, that's fine too, right? Okay. Are you good to change it up from time to time? Okay. Well, guess what you just described.
Why? That sounds like something I know.
Yeah. It's funny because you would just, but don't do CrossFit, it's dangerous,
You're right.
So, and now, the whole like hybrid athlete thing, like whatever, like, it's like, okay, it's like cool, but like,
Mm-hmm.
wait, you run and lift weights?
Whoa, what?
I've never seen that before. So yeah. But whatever, it gets you moving. Good job. That's at the end of the day, right?
Exactly.
But it's just been funny to watch from this perspective how things have sort of shifted over the years, and like it's like I've been saying the same thing since day one. So yeah.
Yeah, it reminds me too of like back in the day too, when I was kind of just starting this thing, there were certain times of the year where like just like business would slow down.
Yeah.
And so I was like, oh crap, what do I do with my time now? And I've got to, I've still got to support my family. I've got to, still put food on the table. Mm-hmm. And so I was working like part-time like at a hospital system, outpatient. And I was coming across like some patients like, who were dealing with like, low-level exercises. Came across a young man who had a brain injury. Mm-hmm. And, he's like probably late 20s at this point in time, was a super fit guy before this. Mm-hmm. And, I worked with him a little bit because I was just covering per diem once in a while in the outpatient. Mm-hmm. And he was just like, so what do I do from now on? Like, if now insurance cuts me off, like, what do I do?
Right.
I'm like, I think you should try CrossFit.
Yeah.
And over the years, I've stayed in touch with him, and he like still calls me on my birthday. So thanks for calling me on my birthday every day, every year. But like I see the progress on of his movement.
Yeah.
From he couldn't even walk without a walker, and the progressions now where he's walking independently, and you know he's doing like all sorts of things like on the pull-up bar, the rings. I mean, he had a severe brain injury.
That's great.
And you see the amazing things that just came with this and his persistence. Like, you know, again, it's like, I don't have any, I guess, data from that, but you see that.
Right.
And it's like, okay, I mean, that's your evidence right there. But of course, being a medical provider, we need to show all this evidence.
Right.
And it's just frustrating.
And that was part of it too. When I started sort of found both of these things, like, I got very much involved in the adaptive CrossFit community, which I'm still involved in, you know. I mean, up until this year, I mean, I was kind of the lead physician on all the wheel walk games, CrossFit adaptive games. And again, it was like this perfect marriage of like, great, now you've finished rehab and you can graduate into this adaptive CrossFit space. Like, to me, it made perfect sense, you know, but like making that connection happen is like a lot harder than it needs to be. So, but that's, you know, that's unfortunately how things are.
Right.
Yeah. So, I mean, another thing I see a lot of are different musculoskeletal presentations of metabolic problems. So a lot of times people will come to me, say like something like a trigger finger, for example, which is often a sign of something else going on. So a lot of times people, you know, you see like their fingers trying to stick, what's going on? And it's like, well, do you have diabetes? And they're like, no. And it's like, well, when is the last time anyone checked to see if you do? And it turns out a lot of times these people do, like they're pre-diabetic or whatever. Same thing with like frozen shoulders, right? Like I see a lot of those, and it's like, I can fix the shoulder, I can inject the shoulder, but there's a reason your shoulder is frozen that we need to investigate. So there's a lot of times when, and again, like, is a surgeon going to necessarily do that? I don't think they're thinking about what you had for breakfast. They don't, you know, they have people to operate on. So, you know, that, and sometimes I get into those conversations too, where I'm saying like, okay, like there's a bigger problem here. And, you know, sometimes people accept those problems as a part of aging. It's like, oh yeah, I'm just like, you know, again, you get older and you can't do anything. It's like, I don't, like, I'm not cool with that. Like, or, you know, people who are, you know, like, see this women with like back problems and hip problems stuff who are like, you know, I ask them to stand on one leg and they go, oh, well, I can't do that. And I go, well, you're cool with that? Like, that's, you just accept that you'll never do that? Like, and that happens with a lot of things. Or like, I'll tell, you know, people to like, can you get up on the table? And they're like, oh, you know, and it's like, that's, you know.
It's almost like they look at you like you're crazy.
Yeah, I mean, I saw, so for example, and I think it's someone that we both know, that she was having knee problems, and I did my little assessment of her, and she had said to the people who she had previously seen, she said, no physician has ever asked me to squat before.
What?
And I said, how can they say anything about your knee then? You know, especially like a young person who's not like an obviously arthritic, whatever, right? So that's not uncommon, you know, and like patients don't know that people should be asking them that, right?
Right.
So, and I'm sure if you polled 100 doctors and asked them, name like 3 like things about a squat, like points of performance, they couldn't tell you.
Yeah.
So.
Well, I mean, here again, you know, we're talking about just like we only have bandwidth for so many things, and then we even have, you know, over a certain amount of time, it's like you kind of like get beaten down because you're like, everyone's going to complain about this. They're going to want to find out what the easiest fix is for me at this point in time.
That's true.
And so it's like, I've even told some patients, I say, look, the next time you go to a doctor, right, you'll make their day if you ask them, what is it that I can do? What kind of work can I put in aside from getting the injection, aside from getting the medication, right? Aside from getting the imaging or whatever, like you'll make their day because it will change up their day, most likely, because the majority of the patients that right, that they're seeing are like, what's the easiest thing? What's the thing that I have to do the least amount of, or
Fix
whatever.
me.
Right,
Yeah.
fix me. How do I fix myself? And like you'll just kind of like reinvigorate them, I think.
That's
If
true.
you
I
went
mean,
ahead and did
that's
that.
1,000% I mean, I see, say, like 30 people a day, roughly.
Right.
And that's 5 days a week, right? So we're talking about 100 people a day. How many of those people do I send to you? It's like, once every couple weeks I'll find someone, right? And it's because most people do not want to expend the time, energy, effort, whatever,
Yep.
into fixing themselves. They want to be fixed, or they feel like it's beyond, they can't do anything about it, or whatever. Or they say, it's too expensive, or whatever. And my rebuttal to that is saying, like, if you are not going to prioritize spending money on your ability to move, what are you spending it on? Like, what is the priority here? Because like, once you lost that, it doesn't matter what else you have, right? So,
Yep.
so, but at the end of the day, like, it's just not everybody. So that's why. But the problem is, when you do have somebody who's looking for that answer, and they kind of deal with sort of the traditional medical system, no one's there to help them. And those people are the people who have the best chance of getting better, right? So I get really excited when I'm like, I know, you got great. I got a person. We're gonna fix this. And almost always, at the other end of it, people are like, oh my god, like this was such a good experience, But it's like, that's like the comet in the sky that happens once every so often, right?
Sure.
Like,
Yeah.
So
Yeah.
it's just how people are,
Yeah. But that's what I appreciate about your approach to things, though, is because even if I talk to a patient that either had met you or had come across from you, it's like, like you had given them the permission to go back into maybe squatting again.
Oh yeah.
Like, and it's like, and they're just like shocked.
Yeah.
Right?
I'm very much. I'm pretty liberal about that as far as allowing people activity. It's very rare. I mean, especially some things I see, because they're usually not traumatic things or surgical things where like you have limitations. But it's more like I favor of I don't say don't stop doing it, do it better, or change the way you're doing it.
Yep.
You might have to change the way you're doing it. And I see like multiple people at the gym I go to, and they're like, oh, I guess I'm gonna have to stop. I'm like, no.
Right.
But when I see them in the gym, I'm like, why are you squatting that much? Lower the weight. Or like, maybe you shouldn't be doing that right now. But I'm very, very rarely tell people not to do stuff. Almost never. I mean, it's almost never. I'll give them some modifications about stuff and whatever. And, and also say like, don't be an idiot, but
Yeah, totally.
but in general, I mean, even older people have arthritis or like meniscal tears or whatever. And they say, oh, well, if I walk, is it gonna make it worse? And I go, well, first of all, it's better to be moving than not moving. So that's one thing.
Yep.
2, yeah, you might make it worse. What's the alternative?
What is
You're
the
going to sit
alternative?
around. Optionally, you sit around and do nothing.
Right.
And hope it stays the way it is, or you move and like maybe it does get worse, but like we can't. You gotta like just do your stuff at a certain point. So when it comes to like these kind of patients too, it's like we can still do stuff. We just gotta like maybe change the box a bit,
Yeah, I mean, because there is a certain level of compromise, but then if you stack on compromise over compromise over compromise, then it becomes like, okay, that's nothing to some degree.
And then the fear kind of builds in, and then you get like this kind of snowballs into like, I can't do anything ever.
Right, exactly.
Or like, certain parts of things, like sometimes it's enough to be like, okay, yeah, it's supposed to hurt, like it hurts, and I get it. And like things hurt sometimes.
Yeah.
So, there's obviously red flags of pain, and then there's just like life is pain, and like you gotta just kind of sometimes operate in that space a bit,
Yeah.
So.
Yeah, and of course we always talk about too, it's like, what's the trade-off here? Would I rather be dealing with maybe some sort of physical ailment, and some of the effects of being active versus like, have I developed a metabolic condition where it's like, where that's going to be like a lifelong thing that's going to either, decrease the quality of my life or shorten my life altogether. So what are we looking at here?
Right, and it's would you have rather? And sometimes it boils down to would you have rather the problem of fitness or problem of sickness, right? Yeah, the rotator cuff tears, meniscus tears, yeah. And if that's like the worst thing that's going on, like you're actually pretty good compared to, I'll take that over the diabetes any day. So it's like, it's a bit of a trade-off sometimes, one for the other.
Yeah, for sure, for sure. So we're gonna kind of transition a little bit back to like a project, into the
Oh,
projects,
yeah,
right? Because I think there's
yeah.
something else too that you've been working on.
Yeah, so I mean, it kind of all in this vein of what we've been talking about. So, this idea of the connections between metabolic health and musculoskeletal health, and kind of building physical strength and mobility. I'm working on a book, like a regular book, not a textbook, that should be out hopefully by next summer, or thereabouts. Tentatively called Durable. That's what it's called.
Love it.
And it's about physical durability and why it's important, and how metabolic and musculoskeletal health are intertwined. And within it, there'll be plenty of stories from like clinic and different things. Also arming people with things to like. There's gonna be a part about talking about like when you're looking at for physical therapist, things to look for. When you're in your doctor's office and they tell you to never do the thing that you love again, what do you say? And then, and also things to look out for as far as like your physical health and strength that can help you kind of have as long of a health span as possible in conjunction with your lifespan. So living well as long as possible and how to do that. So hopefully by next summer that'll be out.
Awesome.
I'm working on it, but that's tentative plan. So I'm excited. I'm excited to get it out in the world because a lot of the stuff I've yammer on about in different places. So we all kind of in one place. So I can just say like here,
Yeah, for sure.
Yeah.
So okay. So it sounds like you're gonna be, you're gonna be speaking to some points about like, are you gonna be like kind of busting any type of myths here in terms of
Sure.
like, what we expect? Like,
Yeah. So I mean, there's a handful of them. I mean, one of them being like, if it hurts, don't do it.
Mm-hmm.
Right. That's a pretty popular one. Lifting will make you bulky. It's another one. So
what about how about like correlation between like imaging and pain?
Imaging pain is a big one. That's kind of how the book kicks off, talking about a case of that. But so yeah, like how how what you see on an image. So a lot of the book really is about empowering yourself, right? It's like you have this condition, this musculoskeletal condition, whatever it is, whatever it's been diagnosed as, and you control a lot more about that than you think. Like the pathology that you see on an X-ray, the diagnosis you've been given. Yes, there's some physical damage there, but like how much it affects you is highly variable, and you have a lot of control over that.
Yeah.
So I think that's like the main kind of driving home point of it is like you're not a victim of your herniated disc.
Yes.
You're not a victim of your meniscus tear or your arthritis or whatever, right? It's like those things are there and they're real and they hurt. And in some cases you need to have them operated on, like totally.
Mm-hmm.
And pain is complex, right? I'm not saying it's just a matter of just like eating some good food and you're good. Like,
Absolutely.
Yeah, there's a lot to it.
Sure.
But there's a lot you can do to make yourself resistant to how much it affects you day to day. Yeah. Function.
Yeah. Function. And it also takes a village of people, a team of people here to kind of get that person into the right framework and mindset.
Yeah, and I think also part of it is saying like, okay, if you've been given this death sentence of a meniscus tear, right? Like, here are things to ask, or here are people to seek out.
Mm-hmm.
And you might ultimately have the same conclusion, maybe, but give yourself the best chance of kind of getting it addressed the way that you want to get addressed, or not like live in fear of it anyway. Like I said, there's a lot of fear about like, I have this thing, I can't do anything ever again. Like, okay, that's not reasonable.
Right.
So,
Right.
And if someone tells you to do that, that's a problem.
Yeah.
So.
Yeah.
Yeah.
Nice. Yeah. Look forward to that book coming out.
Mm-hmm.
Oh, you'll be getting one. You'll be getting one.
Signed copy.
In
in blood.
Oh, maybe. We'll see. We'll put a stack of them right here.
Dang.
So,
there we go.
yeah.
Perfect.
Nice. I'm into it.
That's awesome.
Yeah.
So like, so I mean, like you probably answered a little bit of this already, but like even if we talk about this, like, I'd like the audience to know like what your all-star patient like looks like.
All-star patient?
Yeah.
I think it kind of goes along with what we were saying before. It's like someone who's like, what can I do for me to help me in this situation? And who's willing to kind of learn about it. Yeah, I mean, that's kind of it. It's like the willingness of like, I'm here, I'm listening to what you're saying,
Yeah.
and I want to know more about how to make it better. Like, and honestly, it's not all the time, right? So
Right.
it's like someone who's kind of willing to put the work in, who
Yeah.
who's consistent, you know, like someone who consistently, and also what's really great too is like when patients kind of transition to like self-diagnosing or like it's like, oh, I was having this thing again, I knew blah blah blah, and I started doing this exercise again because I knew it was the same thing.
Yep.
And it's like, great, I've done, my work is done here. You know? Still need sometimes some extra kind of help with it, but like
Yep.
when they're when they can start recognizing things in themselves,
Exactly.
well, that's good. And also people who just kind of stick with it, because I think sometimes you can really, especially when it comes to like these strength issues and stuff, you're like, it still hurts, it still hurts, it still hurts. It's like, just stay with me, stay with me. I had a girl a couple years ago who, it was like a patellofemoral case pretty much, and
Yeah.
she had been, before she came to me, she was sent for an EMG of her leg, she was sent for like all these MRIs, she was sent to rheumatology, like they were talking about effusions that weren't there. I mean, it was crazy what this girl had done, and it was a patellofemoral thing the whole time.
Yeah.
And I just said, you got to work on this strength issue. And she did it for like 2 years, and then finally she was like, it's better. And I was like, it just took it took a long time.
Well, I mean, I figured
You know?
all those procedures, everything that she was given, all that information, like, you know, she already had now, like, you know, she was already starting further from the start line.
Oh yeah.
And she had to play so much catch up just to get there. So who knows? It probably took X amount of time to get back to the
Yeah.
starting line.
Yeah.
And then she's got to take it a little bit further.
Yeah, or
you
it's
know?
like, oh, I went to PT, didn't help. Okay, what do they do with you? Oh, they massage you for half an hour and then like put you on some stupid machine. Yeah, it's always didn't work.
Yeah.
You know, and sometimes even that's like you have to like show people their own weaknesses. Be like, see how you can't do any of the things I just asked you to do? So everything you've been doing, I don't know what it was, I don't care how long you've been doing it,
Yeah.
it's not working.
Yeah.
Because they missed the point. So there was a little bit of that too, is that they sent, again, it's like, oh, knee pain is not operative, go to PT. And it's like, they don't know what they were doing with her, and she wasn't getting any better, and she just spiraled. So then they said, oh, well, then it must be a nerve problem. It must be a rheumatologic problem. It must be. It's like, no, they just weren't doing the wrong thing. Like, it's all it was the whole time, you know?
Right.
Yeah.
Okay. Yeah. So
Yeah.
you just uncovered it a little bit more. And so, like, yeah. So even like with this book, it sounds like you know that. Yeah. So you're basically trying now to like create more of your all-star patients in that way.
Yeah, I
Influence
hadn't
them
thought about
way.
that, but yeah.
It's almost like a
Yeah.
troubleshooting guide for them.
Yeah, there's going to be some elements of that. And also, like, listen, doctors get a bad rap a lot of times. And even the stuff I was saying about, like, surgeons in general, right? It's like, again, I say that with, like, respect for what they do know really well. And also, like, someone, like, Googles something or says, like, my daughter, who's a blah, 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 said that I have a blah, you know, doctors hate hearing that stuff because most of the time it's wrong. It's like, you know enough to not know anything, and now I have to spend my time undoing what this other person told you and, like, whatever. So my goal is like, hand people, like, a list of things, a bunch of questions that, like, are not to, like, trick somebody or to, like, get them to, like, catch them. It's more just like, you should know this stuff before you make a decision about what you're doing.
Yeah.
Or if, like, you're not getting an answer that makes sense to you, then maybe it's just time to move on to somebody else who will give you an answer that makes sense to you. Because for whatever reason, this isn't working out, right? So it's providing a guide, but not in a way to kind of, like, upstage people. Like, that's not the goal. Because
Sure.
I hate that when people try to do that to me. So
Sure.
that's not really the plan, but
Yeah.
yeah.
Okay. That's awesome.
So we'll see.
We'll see.
Yeah.
Exciting.
Yeah. Yeah. So for all of our lucky guests who appear on the podcast, we have 2 surprise questions at the end.
Okay.
So Jordan's going to take that first one.
Okay.
The first one is, when do you feel like you're in your element?
In my element, doing stuff like this, because people just let me talk about, like, whatever.
Is that nerding out and stuff like that?
Yeah, it's like, let me tell you all the things that I like talking about, you know. So that, or, you know, throw me a barbell, I'm good. You know, I like that. So
Very nice.
yeah.
Nice. Oh, this one you're going to love.
Mm-hmm.
All right. So Jordan and I talk a lot. We talk about music and we talk about songs and things like that. So, you know, we have conversations about, like, what's our perfect song? Right?
Oh, easy.
So, what do we got?
going to tell you a story.
Okay, let's hear it.
So the year is 2008-ish.
Okay.
Yeah, 2007. And I'm in a med school interview. And they ask me, they say, and they try to throw you these like questions that are like, oh, you know. And they say to me, what is, if you can pick a lyric in a song to describe you, what would it be?
Yeah.
So on a side note, I'm a very big Jason Mraz fan. A very big Jason Mraz fan, like in a way that's, yeah.
That's
and I know
scary.
I know all his deep cuts things that nobody knows, right? So, so he has a song. It's called Plain Jane, which no one has ever heard of,
Okay.
and you can't even find it.
Spotify?
Nope, you won't find it even on any album.
Get
Okay.
out.
He's only played it live a handful of times or whatever, but whatever. So there's a line in the song where it says, you make all the fashion statements just by dressing up your mind. And that's always resonated with me. And then when the person asked me a question, I said, boom, this is the answer. And she was like, oh, I like that. She's like, what song is that? And of course I had to then describe, like, it's a Jason Mraz song, nobody knows it, it's really good. She's like, how can I get a hold of it? So basically we spent the rest of the time talking about like how to get a hold of the song. And at the time there were CDs, so I was like, oh, you know, CD, whatever. And so needless to say, I got in, right? I got into med school, right?
Right.
So I credit Jason Mraz with that. So fast forward to this year,
Yeah.
and I've had an opportunity to share that story with him directly.
Amazing.
So at first he's like, does that make me a doctor? And I said, kind of, you know, like, you know, music heals.
There we go.
Doctors
Yeah.
heal, right? We're music is medicine at times.
Yeah, yeah.
And then I was at a show fairly recently, and he actually asked me, he said, what song do you want me to play?
Whoa.
Which was like a dream, like Jason was asking me what song he wants me to play. So I said, Plain Jane. And he said, whoa, that's a deep cut. And he's like, I have to do homework for that one. I don't know if I remember all of it. So, you know, one day maybe he'll play it again. I was like, do you play that song anymore? He's like, no, I haven't thought about it in a really long time. I was like,
kidding.
okay, well, maybe one day. But if anyone can actually find a recording of it, I have some. I have two, actually. But if anyone can find a recording of it and hear it, and that line is gold. So yeah.
That's cool. So far of all the guests, I think that's the coolest answer and response we've gotten.
Yeah.
So
So
we're going to have to dive deep and find this.
if not, I'll just send it to you because you cannot find it. It's literally cannot find it anywhere. So, but I have it. So
That's
yeah.
awesome.
Yeah.
So Plain Jane, Jason Mraz.
Yeah.
That's awesome. Cool.
Yeah.
Thank you so much.
Thank you.
It all came back to Jason.
Yeah,
Right?
it's all full circle.
Yeah.
Yeah,
that's
all
so
roads lead
crazy.
to do.
That's so crazy. Well,
Yeah.
Dr. West, thank you so
Welcome.
much for being here. I think you dropped so many nuggets here that our listeners are really going to appreciate.
Sweet.
And it's definitely clear that that for your passion for everything that you do, it stands out. So yeah, just thank you so much. It really means a lot that you're here with us.
Thank you. Thanks for having me.
Awesome.
And where can they find you?
So at Amy West MD on Instagram, Twitter, whatever it's called now.
Yeah.
AmyWestMD.com, working on that. And all things for the book will be kind of rolling out somewhat soon. So
Very nice.
Awesome. Yeah, so guys, if you're on the socials, go ahead and find Dr. West. You're going to find a lot of awesome information. And she, once in a while, I think in her story, she'll share her fits with her figs and her
and
sneakers.
and my Whoop bands to match. And
There you
I
go.
like to coordinate, I like to match. So.
Yeah.
I'm also I also see patients. I work for Northwell, so you actually want to be a patient. That's where I work.
Yep.
Yeah.
Awesome.
Yeah.
Yeah, thanks for tuning in,
Yeah.
guys, and we will see you soon.